Hi, everyone. So today we're taking an inside look at dissociative identity disorder. You may also see abbreviations of it as DID in certain things. And I found this really fascinating. I found this to be a really fascinating disorder. Um, so let's get into it. Many people know dissociative identity disorder by its former name, multiple personality disorder. Dissociative identity disorder is an authentic mental health disorder, and this is a big deal in saying that because for a long time there's been a lot of biases and misconceptions, and everybody had a feeling about this disorder not necessarily being its own actual mental health disorder, maybe more like a extreme version of PTSD or something along those lines, not a separate disorder on its own. So it is an authentic mental health disorder. A lot of research has been stacking up to substantiate that. It's characterized by an interruption of identity with at least two separate identities or personalities. The disruption in identity involves a marked discontinuity in sense of self, sense of agency, and is accompanied by related alterations in affect, behavior, consciousness, memory, perception, cognition, and sensory motor function. Dissociative identity disorder is a trauma-related disorder. It occurs in a response to extreme stressors, most often physical abuse or sexual abuse endured during early childhood. The child's ego who is experiencing the abuse, their ego becomes overwhelmed by the abuse and it fragments as a method of protection and survival. People experiencing symptoms can forget things that happened throughout the day, not remembering major events like the abuse itself, and missing hours out of the day. All of a sudden, they'll be in bed, and then next thing they know, they're standing outside, and it's later in the day, and they're not sure how they got there. And obviously, not knowing how you got somewhere would cause a great deal of distress and concern for what's going on with you. Individuals suffering from these symptoms often have a really hard time functioning in social events, work, school, anything like that. Probably the most well-known symptom of dissociation is depersonalization. Depersonalization is when a person feels like they're kind of like on autopilot, or like they're pretending to act normal or be human, but this isn't what's feeling normal to them. Like they're playing a role, kind of. Adolescents are often misdiagnosed several times, even though it's widely known that dissociative identity disorder is associated with childhood trauma. In a study of 100 adults with 100 patients. It did not specify the age. I think it was adults, though. With dissociative identity disorder, 97% had endured abuse as a child. 83% had suffered sexual abuse as a child. 75% had experienced physical abuse. And 68% experienced both types of abuse. People with dissociative identity disorder often end up at an emergency psychiatric facility due to self-harm, flashbacks, non-epileptic seizure, or even possibly a suicide attempt. Dissociative identity disorder is also a highly comorbid disorder. PTSD is the most common comorbidity with 88% being diagnosed with PTSD along with dissociative identity disorder. 60% had a diagnosis of ADHD. The ADHD portion is really interesting because a lot of times when screening adults for comorbidities and disorders and stuff, ADHD is not necessarily one that's predominantly brought up, but the numbers are showing a possible link between ADHD and dissociative identity disorder. Um, some cultures and religious groups believe dissociative identity disorder is a spiritual or demonic possession. And in some cultures, they believe the person is possessed by a deceased relative. Maybe God is talking through them. In other cultures, they may believe that it's an evil spirit or demon possessing the person. This can be a very dangerous misconception for those with dissociation or dissociative identity disorder because the healers or religious leaders may want to do an exorcism. Exorcism can cause a lot of mental strain on the person, physical harm as well, when the person actually needs psychiatric treatment. So the exorcism isn't going to do anything, and they can want to do it again and keep it going, and they're not giving up. People throughout history have died from attempted exorcisms. Unfortunately, when we deal with mental illness, we immediately deal with the stigma surrounding having an illness and seeking help and receiving treatment. Dissociative identity disorder has been sensationalized in the media, sometimes sparking fear or intrusive fascination. So, with dissociative identity disorder, this disorder is based around childhood trauma, right? Well, people with childhood trauma who were being abused are often deeply ingrained to hide what's happened, to not tell anyone, to keep it a secret. So it doesn't present like in your face or anything like that. They often are working really hard to hide the fact that anything is wrong with them. The last thing they want to do is bring attention to what happened to them. I think that speaks volumes to the nature of the disorder. There's also the sensationalized nature of it in the media, where they make it seem like they're so, like over the top and they're just switching from personality to personality, when in reality it's very subtle. Oftentimes it can be missed by a lot of people, and that thought of how people perceive them make it to where they don't want to go receive a diagnosis, and where diagnosis cannot even possibly be harmful to the person because of how people perceive the illness. There's also a lack of research surrounding it because of the fact that it's around childhood abuse. They don't really want to go and talk about their abuse and put themselves out there like that. As well as if you do research with children and it's about childhood abuse, everyone is involved and is responsible. The researchers, the parents, the teachers, like everyone in society is responsible, because the one thing we can agree on is that it's an adult's job to protect children. This disorder is based off the fact that that protection did not occur to an extreme extent. So there's still a long way to go with that. Every diagnosis of dissociative identity disorder is treated on a unique case-by-case basis, usually with psychodynamic psychotherapy. Other techniques have been successfully used, like art therapy, family therapy, group therapy, and hypnosis. With family therapy, you have to be very careful because a lot of people that have suffered abuse have been abused at the hands of family members that they may not be willing to talk about, or that they are telling you it's my mother, it's my father, it was my older brother. So family therapy can actually cause a lot of setbacks and cause more trauma than was there previously. But there has been some really good leeway in family therapy involving the individual with dissociative identity disorder's children or their partner, because a person with mental illness is not just affected themselves, but everybody else around them is affected as well. There has been success with psychoeducation. It helps the client understand what's going on in their body, in their brain, what they're experiencing, why they're experiencing, what led to it, and it begins their understanding of what's happening, which can then start the process of healing and getting into what's going on in the integration process. The use of medication has also helped manage symptoms that get triggered, and it can be really successful as well. Because if we can manage the triggers, it doesn't initiate the personalities coming forward. Clients with dissociative identity disorder, unfortunately, can relapse. So follow-up appointments are useful in avoiding relapses. If someone in their family dies that they're close to, if they unfortunately end up in another abusive situation, a car accident, another medical procedure, if they got it from, like medical procedures previously, all these things can cause them to feel overwhelmed and unsafe, and then their personalities will come forward again to protect them and as a method of survival. Integration is normally the goal for treatment, but if a client is not ready to integrate, it can be very harmful to try and force that client to integrate. There seems to be a huge lack of knowledge within the mental health community about dissociative identity disorder. And this leaves clinicians to not understand that this isn't a rare condition and that it doesn't present in a flamboyant movie-like way, that it's actually really subtle, and they don't understand how to look for it or how to question and assess for it. A key issue in diagnosing dissociative identity disorder is the standard diagnostic interview. The standard diagnostic screening does not include questions about dissociation or that would lead anybody to dissociation. So by revamping that interview to inquire about dissociative symptoms, clinicians could correctly diagnose the disorder earlier. A lot more research is needed in the disorder's etiology and treatment plans and options and stuff like that. But again, there's a lot of research that's lacking because of the fact that this is about childhood trauma and the way that adults hurt children. So I think in the future, we're starting to make way and we're starting to get there. There have been a lot of studies in I think it was 26 different countries, including our country and Europe and Africa and all that type stuff. So we're getting there, but we definitely still have a long way to go. I definitely encourage everybody to research this a little bit, to figure it out for yourself, understand the symptoms. That way, if you ever encounter somebody, you understand the types of questions you should ask or what you're looking for, because it's not going to look like anything that we've ever seen before in the media. I hope this was helpful, and thank you.